My name is Tim Reha, host of Digital Health Live here in San Francisco for the Summer Summit, hosted in partnership with UCSF CDHI program. Great panel was just happening called Digital Health Grows Up. It's more of a conversation. And we have Dr. Roy Smythe, or just Roy, who's the Chief Medical Officer for Avia and CEO of HX360, coming in from Chicago. How are you doing?
I'm doing well. Yeah, thanks for having me.
So it's been an interesting morning. We were just speaking with a best-selling author on how digital health quite isn't approaching levels which we see in other technologies like consumer electronics, things like that, adoption rates. You were covering adoption rates and some other interesting things. But first, about your background.
Sure. So my 26-year-old daughter says I have executive gypsy syndrome. So I trained in medicine. I'm a physician, surgeon. Spent some time at MD Anderson running a solid tumor program in a big research lab. Spent some time as a biomedical scientist with NIH funding. Spent some time as a health system and medical school surgery department chair at Scott & White and Texas A&M. Spent some time as a chief innovation officer at Scott & White and Texas A&M, and then moved to Chicago about 2 years ago.
Okay, and you like working with startups as well.
Yeah, we do. So Avia is a company that basically works with health systems. Unlike a lot of investment firms, we start with the problems, not the solutions. So we have about 20 health systems that work with us: Mayo Clinic, Northwestern, Providence, Sutter, some names that will be familiar to people from California. Sort of dig in on what their operational problems are, then we find early and growth stage companies to meet those needs.
Tell me about what you're covering on stage.
Yeah, so we were talking about the digital health, space grows up, but if it's growing up, why is it having such a hard time finding out where it should be going to school, sort of thing? And so, the question is, with all the great foment and investment and creativity in digital health, why are health systems or the providers themselves not adopting these tools at a rapid rate?
Okay. What were some other interesting points? You're talking about adoption rates and uptake, but within not just consumer side, but within the whole medical.
Yeah, so I like to think that there are four big impediments to health systems adopting these tools. The first is what I call the yoke of previous success. So lots of years in the old model, mainly process improvement and manpower optimization. There's also the problem with focusing mainly on diagnostic and treatment technologies and not technologies that change delivery itself. There's also an issue with risk aversion. Health systems are risk averse, physicians are risk averse, health system executives are risk averse. There's good reason for that. We want them to be risk averse, but it sort of bleeds over into these areas. And of course, the last thing is the issue of the payment model not necessarily supporting the use of these tools.
Okay, so how does a startup navigate these waters when you have a risk-averse, area and they're risky by nature?
It's really hard. It's really hard. There's literally hundreds and hundreds of companies that are in the startup, period now. They're either starting or need to grow, and so the competition's fierce. The ability for the provider organizations to discern one from another, or what's good and what's bad, or what they should even be using, is difficult. So the sales cycle is really difficult for these enterprises, and companies like Avia, basically exist to try to facilitate those interactions happening more efficiently.
What's coming up next for you?
Oh gosh, it's been a busy week. We had the National Healthcare Innovation Summit earlier this week. I had a couple of executive education programs at health systems I was teaching. I'm hoping not to do much of anything next week.
As it's summertime's coming up, maybe go fishing. So, how do people connect up with you? I'm sure there's a ton of entrepreneurs who'd like to link up and other folks.
Yeah, just in general. So you can find me on Twitter at Will Smythe MD, WILLSMYTHMD. And then if you'll just put in to your search bar Roy Smythe Forbes, I write a monthly column for Forbes, and I'd like for more people to read that.
All right. Well, we'll send everybody to Forbes magazine. Thanks, Roy, for being on the show.
Thank you very much.